Wow, good morning and welcome to this edition of Dialogue Box on Blossom Nigeria. We are talking the nation in the right direction. Don't always forget that. Trust you are doing well and you are making progress in every situation and circumstance. Don't forget that we've always told you that nothing can bring you down and you can always move upward and forward. So this morning we are looking at the health situation of the country and how we can make all work towards a safer and healthier society. Talking about the entire country, Nigeria. So what more can we do to make the COVID-19 pandemic not a scourge that can hold down any sector in Nigeria? And quite a lot has been achieved so far by the government and other institutions, but we still need to look into what and how far they have gone so that we can make the necessary progress and move forward in the right direction. So this morning we are talking about working towards a healthier and safer COVID-19 free society. That's what we're looking at. And with that, we'll just give you some background details and we'll expect you to call in on 08030887339. 08030887339, and we also have another number 09052525107. 09052525107. And always remember to be with us on our YouTube channel. You can share, you can subscribe, and every time you do that, you are also boosting our influence as the government is getting more and more into they can hear what we are saying. That's the essence of what we are doing, and they can also take the right steps to improve the nation in the right direction. And also on Blossom Nigeria page on Facebook, invite your friends and contact and let them be with us as we also improve our influence and spread the nation round that indeed Nigeria can blossom and be better than what it is right now. So as we discuss the health situation in Nigeria right now, we'll just give you some background details and we'll go on from there. That according to a tweet from the Nigerian Center for Disease Control, that's the NCDC, on Wednesday, that's August 26th, yesterday, Nigeria now has 53,021 confirmed COVID-19 cases. I take that again, that Nigeria now has 53,021 confirmed COVID-19 cases, with 221 new cases that were recorded yesterday. So from that figure, we have 40,281 patients that have now been discharged, and the number of deaths has increased to 1,010 people that have died so far from the COVID-19 cases. So according to this report, since the opening of some sections to resume activities in taking care of the COVID-19 patients, it becomes even more difficult to enforce the social distance rule right now, because if you look everywhere around, we don't really think social distancing is holding. Everybody can move, people are talking, people are moving, people are hugging, people are shaking. So there is nothing like a social distance rule right now, and Nigerians are no longer subjecting themselves to the COVID-19 test. That is a major challenge for some. They believe that if Nigerians are subjecting themselves to the COVID-19 test, then it will give more assurance from the government on how much more they have been able to contain the COVID-19 pandemic. But most Nigerians believe that subjecting themselves to the test is always going in the way that they don't expect. That even when they have symptoms like a high fever or maybe a cough or whatever else that goes along with the symptoms that have been identified, that a lot of them are just tested positive for COVID-19 and they don't like the sound of it. For some, they see it as if, so that means isolation center. And we know that right now the isolation centers are not even fully in existence. So what more can the government do to guarantee a safer society beyond just the formal protocols that the government has already instituted that are really not working right now? A lot of them are not working now. So what more can they do? And from all the records that we have, the Director General, that's the World Health Organization, has also announced that it's working towards ensuring that a proven safe and effective COVID-19 vaccine is available. so that it will be accessible to all the countries. Definitely Nigeria is inclusive. So it's Director General Tedros Adhanom Ghebreyesus. I wonder where this name is from, but Tedros Adhanom has stated during a virtual session of the organization's 70th Regional Committee for Africa that, okay, sorry about that hitch. There was a little break in transmission, but it's being sorted out. So we're talking about the World Health Organization, the Director General, and how they are working towards getting a vaccine that the countries can use, Nigeria inclusive. So with this fact, the question remains, what more can the government do to improve the entire health of the nation and to ensure that everyone has access to the right treatment? And from what we can hear and see, if about 40,000 people have been discharged, so the question is, what were they treated with? In other words, is there a treatment now for COVID-19? And if there is it not better for the government to let the citizens know so that they can also have a form of preparation in terms of maybe having some of these drugs accessible to the populace? So, but if not, why? Because these are very, very key issues that the country has to look into. And don't forget that we are not discussing just about politics, and we can't play politics with the lives and health of people, but we have to look into the core details. And that is why the government has to look beyond just giving some very formal protocols that are not being observed. Like we talked about the social distancing, apart from the formal pictures you see that are snapped with the distance and everything, nothing else is being observed out there. Go to the streets, go to the markets, everywhere is as busy as ever. Go and check out the buses, nobody is observing any social distance rule. And with that, we also have concerns coming from the treatment. Like we stated earlier, if some people are being discharged, over 40,000 for that matter, so that means there must have been a treatment procedure that was followed. And what was it? So these are some of the key issues we'll look at in our program this morning. We have a call coming in right now. Let's quickly take this call. Hello.
Yes,
good morning.
My name is Chukwu. You called me before. I'm calling in for the program.
Okay, where are you calling from, sir?
I'm calling from Abuja.
Okay, sir, you are welcome. So what's your take on the government's effort towards containing the COVID-19 pandemic, and how much more do you think they can do in really working towards a safer society?
Well, I think that from the effort of National Disease Control and other agencies, including international agencies that have been involved in disease control, like the one that recently took place, on polio eradication recently.
Yeah.
It was polio was a success, and I hope that COVID-19 will be a success too. But government effort is not enough.
Okay.
Yes, because the isolation centers are nothing to write home about.
Okay.
Some of the health centers, the workers there, they do not wear face masks. They do not screen the infrared thermometers and other things they use to assess the temperature of people
okay.
who visit. They are in bad conditions. They are not working.
Okay.
And so you cannot say someone has COVID-19 when you do not have the testing kits. Some of them, they take samples, some of the suspected cases, they take samples for tests, and the result will not come out until one month later, or they stay there endlessly. So the mutation period of COVID-19 is 14 days. How do you now bring a test after 1 month and say you've tested someone for COVID-19 or COVID-19 or not? So government has never been sincere with the people. There's a lot. Some people see what they are doing as business, but I think that there's some genuine efforts and some not very genuine efforts.
Okay.
That's it.
All right, now talking the nation in the right direction, what more do you think the government can urgently start now so that we can guarantee the lives of Nigerians?
First of all, there has to be sincerity of purpose.
Okay.
You understand?
Yeah.
When you watch people who have died of COVID-19, if they are rich people, the way they bury them, nobody cares. They just carry them on the body, and people are struggling to touch the body of someone who has died of COVID-19. So the issue of social distance does not apply to everybody.
It doesn't.
That is the first thing you have to do. You know, you must create a law. The law must apply to both the rich and the poor.
Yeah.
If somebody dies of COVID-19, he should be isolated.
Okay.
He should be buried very quietly. Those who are going to bury him must put on the necessary costume or whatever you call them, PET, before you bury such persons. If in some sense societies, if COVID-19 is contagious through touching people who have died of them, there's nothing bad in cremating the bodies. You understand? Although that is alien to our culture, but much as it is not that serious, they should bury the people properly. If somebody dies and maybe 20 people go for the burial, the person has been buried.
Okay.
I had a friend whose wife died, and he's such a close person to us, and we wanted to come. He called us and told us, well, because of the regulation now, only 20 people will be allowed to be there, permitted by the local government. So please, I know how much you love me. I know how much you care about my wife. Please, you stay away. Just pray for us. That is it. In a sense, society, that's what it should be. Government should be concerned. Yeah. So government should apply the same law to the rich and to the poor, to the Christian and to the Muslim, to the president and to everybody. The police who arrest people who are not walking on the street, not wearing face masks, should also arrest the big man there who breaks the conventional law of social distancing.
Okay, sir.
Do you understand?
Yeah,
and the necessary equipment, the testing kits, they should be in adequate supply. Now schools are opening up. Schools are opening up, and children will be going to school, teachers will be going to school. But I can tell you that a lot of schools will not have the infrared thermometer to test the temperature of the child or the teacher to know if they are COVID, if their temperature is not high enough to make them suspect.
Okay, sir, we have I think we've gotten the very core points that you have made, that in all that the government is doing, there should be sincerity of purpose. And in every aspect of the effort that they are putting into containing the scourge, they should see to it that the same measures apply to the rich, the poor, those in government, and those in schools. Everywhere it should be the same measures that they should use.
Also, if the government claims to build isolation center or to set aside a particular building as an isolation center, we know of the privacy of the people who should be. COVID-19 is not a disease you get out of maybe immorality or something bad, criminal. It's a disease. It came to us. We didn't invent it.
We didn't invent it.
So when you have an isolation center and people are there, it should be televised. You look at overseas, you see people in isolation center, you see them. In hospitals, you see them. You see the nurses well clad, the doctors well clad, all health officials well clad, and the patients well taken care of. Why can't Nigerians' own case be like that?
All right. Thank you so much, sir. The points are noted. We are really grateful for your call. And that's Mr. Ayo calling from Abuja.
Yeah. You're welcome.
Thank you so much. We look forward to hearing more of you. All right. We have another call coming in now. Hello. Okay, the call will come through. We have been talking how to give our society that sense, not just a sense, but a safer and a healthier society and a COVID-19 free society. So how much has the government done? Have they done enough? And with what has been done so far, can we really beat our chest as a nation to say that yes, as government, as a private sector, everything is in place and we can be sure that COVID-19 will never hold us down as a nation? So these are the things we are looking at. So from what our last caller just said, there should be sincerity of purpose from the government, and they should not see it as a means of just getting grants from foreign bodies, but look at it from a very sincere approach to see to it that the same measures, the same kits that are being used for the rich, according to him, are also being used for the poor. And even for those that are the young people that will be resuming the secondary schools and the schools generally, the thermometer check and every other thing should be in place, and not just for some schools but for all schools, according to him. So we have a very, very valid point that has been made, and we can also get you to call in right now. We know that several calls have been trying to come in, so continue and we'll get some of your thoughts and put everything together, because this is dialogue box and we must keep talking and talking the nation in the right direction. All right, so as we do all of this, we also have to look into the aspect of how prepared is our nation for the future cases, because we know that several Nigerians, like they have complained, the NCDC has complained that several Nigerians have not. Okay, we have another call coming in right now. Hello.
Hello, good morning.
Good morning. You are welcome to Dialogue Box on BlossomNigeria.
This is Kendra Nwokolo speaking from Ogba.
Okay, Ogba, Lagos. You are welcome, ma. You are actually an analyst that we're expecting earlier. So how are we doing, and what's Nigeria's approach towards the COVID-19 scourge from your own view?
From my own view, so far, a lot of people have been skeptical to be tested.
Yeah.
Because of the ideology people and the mindset people have come to have concerning the way things are being done.
Okay.
Take for example, some people, a lot of news are going on right now on social media. You know, social media is a platform that things, information spread very fast.
Yeah.
So when you have people testifying that, oh, they just got there and they were tested, even when they were just having maybe different symptoms, and they were tested and they told them that they had COVID-19, this and that. So a lot of things are really going on. So if NCDC wants to really make people comfortable, they should be true to themselves.
Okay.
They should do things with a more compassion for the people, and not because you want to increase the
number
or you are trying to meet your own target in your own negative way. It shouldn't be like that. Let's work towards humanity. When you want to give, you want to do something, do it and let people see the sincerity in it.
Okay, ma, can you just give us a second? Let's take this and we'll get back to you shortly.
Okay.
Hello, ma.
Hello, good morning.
Hello, good morning. What's your name and where are you calling from? Okay, Choma calling from Abuja. You're welcome, ma.
Thank you.
Okay. Can you hear us?
Yeah, I'm hearing you clear.
Okay, so your volume is a bit low. But we've been talking about the government's approach to containing the COVID-19 scourge. So, ma, a quick one from you. What is your take on it?
Yeah, I see your question here. What more should the NCDC do and whatever?
Okay, ma, you might need to call back. Your volume is a bit low.
Okay.
Okay. All right, it's better now. You can continue. Hello?
Okay.
All right.
Hello? Is it better now?
Yeah, it's better.
All right, my take is that we have issues that have been taking people's lives, and that we never had healthy environments even before the COVID. The hospitals are not in order. We do not have facilities. So I think they should just allow people be.
Okay.
Trying to quarantine and let people to go in isolation and all that will not solve the problem. People die every day in Nigeria. Genocide is going on in the northern part of Nigeria. Nobody is doing anything about it. So they should allow us to get used to the COVID. That's the truth. Our system will eventually get used to it.
So the
system that has been consuming issues in the country, you know, we have that strength of, you know, getting used to situations. So I personally do not see COVID as anything. Sincerely, I will not lie to you.
Okay.
It doesn't matter how they place it. As far as I'm concerned, we have issues diseases that kill people every day, and nobody cares. Maybe because the COVID affects the rich. That is why they are so concerned. That's the truth.
All right.
Secondly, you said, how can they reduce or get rid of pandemic on the nation?
Yeah.
Who has told us that it has come to stay? Now, if this thing has come to stay, it is better we get exposed to the air. When you quarantine people and keep them indoors, by the time they come out, they won't be able to associate very well with the environment.
Okay.
And that will be exposing the person more to the disease.
Okay.
So you should allow the body to, get accustomed to it.
Okay. All right. Thank you so much, Ma. We have another caller that have been waiting for you to make your point, and that's a very valid point you have made. We will continue from there. Thank you so much. We appreciate your call.
Thank you.
All right,
Hello.
Ma. Hello.
Yeah.
Okay. Sorry, Ma. We
as I was saying,
yeah.
People now have a mental. The whole thing is fake.
Okay.
So they are not even because when you look at it, every day we go to, like me, I'm a businesswoman. I go out on a daily basis and I sit with a number of people. And every day you come back, you say you want to isolate yourself for 14 days. You do that and you are okay. Nothing is going on. And if you need to come to the market and see people robbing. There's nothing.
There's no social distancing.
There's nothing going on. Do any social distance or even is it the mala that is selling it? Nobody is doing any social distance and people are okay. So at the time I'm feeling like, is it that this sickness or this COVID-19 is only affecting the rich, or is it that we that are under the sun, something is going on and it's burning up the COVID-19 that we're all we don't really understand what is going on. So at the time people are not seeing that as a scam.
Okay,
so
Ma.
when you now want to test someone to go and test, people are now thinking that you are not serious because they are not taking the government serious because nobody's really, the poor are going about their work, are going about their business, and then nobody is having any symptom.
No.
So not telling us to go and test and it's like telling us to go and test. It's like a trap. You want us to be trapped into your plans. By telling us to go and test, and you will not come back. You say it is positive.
Okay, Ma. Okay, thank you so much, Ma. But a quick one. Medically speaking, now that means every other thing that the government needs to put in place is already in place, and there is no fear of the.
Going about our work and the government, whatever the government wants to do, let them do it and be truthful to themselves. Let them tell us the reality of what is really going on.
Okay.
Yes,
all
let
right.
them tell us, open up. Just the way they opened up for other terminal ailments, and people are aware. Oh, a lot of people, you want to go and test for HIV, you want to go and test for different. There are so many other ailments that are even more serious than COVID-19.
Okay.
But because of the way they are taking it, people are now seeing the thing as a scam.
So that's why we should.
There is COVID-19, but let them come up and tell us the reality of what is going on.
Okay.
There's no need to do this hide and seek we are doing in our country. Do you get it? So Nigeria should be more truthful to ourselves and be realistic and put the humanity first.
All right, that's the same sincerity of purpose. All right. We will look forward to having you call back maybe some other time. But thank you so much, Ma, for the wonderful points you made today. We are really grateful for your call. Thank you.
You're welcome.
All right.
Well done, BlossomNigeria. God bless you. You're doing a great work.
Thank you so much, Ma.
All right.
All right, it's been a very busy day with buzzing lines, and everybody wants to say something about the COVID-19 situation. So we'll still have to apologize to callers who have been calling and they've not been able to get through. You can call again. It's been very, very interesting talking about the COVID-19 situation. How much has the government achieved and how far can they go in assuring Nigerians that COVID-19, according to some, is really not a scam, and even if they think COVID-19 exists in that sense, it should not be something that is only applied to some sectors, like some say the rich, like a sickness for the rich. No, it's not. So everybody should know the sincerity of the government's purpose and work accordingly. So that is how much of the feedback we have gotten so far. And even the caller, Mrs. Choma, that called from Abuja, also said that a lot of these pandemics have been on before, so it's not like the first one. So whatever it is, government should come out openly and also tell people what exactly it entails, so that they can work and know how to contain some of this scourge as expected. All right, we have another call coming in right now. Hello? Hello?
Yeah, I want to contribute to the program.
Okay, good morning, sir. A quick one. What's your name and where are you calling from, sir?
Actually, towards LD COVID-19 environment, my own take is this.
Sir, your name, sir, and where you are calling from? Can you hear me?
Can you hear me? Hello?
Hello, I can hear you. I said your name, sir.
I can't hear.
Okay, it's like there's a little challenge with the sound. All right, continue. Continue, sir. Hello? Hello? Okay, I think we lost that call. He might have to call back. So thank you so much for your calls, your participation, and all that you have been saying concerning concern, interest in working towards a healthier, safer society. Okay, we still have some responses here. Let's take one from, okay, our caller is back. Hello, sir. Can you hear us now? Your line is breaking, sir. Your line is breaking. Maybe you might still have to call back. So sorry about it, sir. All right, sorry about that. Still a little hitch, but we are moving on. So on the COVID-19 scourge, I was about to give us the angle that Yeshua Iben is looking at it from. He says that COVID-19 is a scam. Yesterday, NAFDAC DG Professor Christiana Adeyeye said chloroquine is potent for COVID-19 prevention. The same chloroquine that hasn't been criticized by WHO. Arise, O Nigerian, go and buy up all the chloroquines in all pharmaceutical shops. That's coming from Yeshua Iben. So according to him, if the NAFDAC DG says that chloroquine is effective in treating the early stage of the COVID-19, then that means Nigerians should buy it up. All right, another call. Hello?
Morning.
Good morning, sir. Yeah, it's better now. You are welcome. And what's your name, sir?
I'm actually Pastor Michael.
Okay. You are calling from Lagos or Abuja?
Yeah, I'm coming from Lagos here in Keja.
Okay, you are welcome, sir. What you were saying something about the COVID-19, the pandemic, and your own approach to it.
Yeah, yes, I saw your post, and my own contribution to it is that you said, how can we reduce the particularly related to our nation?
Yeah.
My number one take is that the COVID-19 is attacking our socio-economic way of life.
Okay.
And so because it has to, the infection has to do with, the spread of the infection has to do with the rate at which we interact with one another. It makes it difficult to get rid of.
Okay.
So it's difficult because you see people's way of life, culture, greeting, talking together, hugging, shaking. It's very difficult to just, and for people not to be able to do that one, it's difficult. That's why it keeps spreading, and that's why it's still increasing. My own take is to get rid of it is going to be a little bit difficult.
To get rid of what?
To get rid of the COVID-19 spread.
Okay.
This is difficult because it means that we're going to short-circuit people's way of life.
Okay.
Also. So my own take is that for.
Hello? Hello, there seems to be a little network challenge from where he's calling from. All right, we've gotten the point so far that containing the COVID-19 scourge. He was about to tell us much more about what he thinks on how the government and individuals can go about it. So we're just giving ourselves an aside from the comment Yeshua Iben sent. He said, if chloroquine can take care of COVID-19 from the early stage, as has been confirmed by the NAFDAC DG, Professor Christiana Adeyeye, then Nigerians should go ahead and buy up all the chloroquines in all the pharmaceutical shops in Nigeria. So that's really, though he has made a very solid point, but is an aside that can help us laugh and also be very, it makes it even more interesting, because this is an issue that has been of a lot of dissenting views on this. Even from the United States, where hydroxychloroquine has been like, oh, the doctors are saying that that's some parts of the doctorate or the doctors, medical doctors are saying that this is effective in treating COVID-19, but the government is also insisting to some extent that it is not so. So it's very key that if the DG, that's the Director General of NAFDAC, in Nigeria, is saying that chloroquine is potent in treating COVID-19 and also in preventing it, then this same chloroquine should also be a means of tackling this challenge to a large extent. So all Nigerians should also have that full knowledge, and nobody should be left groping in the dark. Very key. So, and also the government, like most of our callers have said, there should be sincerity of purpose. No government can do so well by deceiving the populace and letting them know what is not. No. So the government should be sincere in their approach to tackling the COVID-19 scourge and seeing to it that, right, we have this call coming in. Just a quick one before we wrap up. Hello? Hello, good morning. Hello, good morning. Hello, good morning. Okay, we lost that call. So, as we're saying, the government should be sincere in their approach and see to it that whatever they are giving the citizens to work on or act on or take in whatever format should be the measure that is being used both for every sector of the economy, the rich, the poor, and everywhere. And see the same measures that are being used. Hello.
Hello, good morning. BlossomNigeria.
Okay, good morning, sir. You are welcome. Is this Mr. Chineye? Okay, Mr. Chinkwe. All right, you are welcome.
Good morning.
Good morning, sir.
I like today's subject.
Okay.
And it's something we all need to tell ourselves the truth.
Okay.
You know, I am very not mindful of my words in this area. That NCDC is very insincere in their approach to the fight against COVID-19.
Okay.
Yes. Let me give you some instances. Now, you say you are testing people for COVID-19. What do you want to do with the results? You're not telling us. You are testing them for COVID-19. Okay, after the test, what is the way forward? You test them, you report that COVID-19, this is the number of cases that we have seen. And that is all. Then, if the purpose is to quarantine them, go to our isolation center now. There's nothing going on there. So what is the essence of testing people when you cannot provide treatment? Fine. If we say you want to provide treatment, means there's a treatment for COVID-19.
But if we have, sir, can you hear me?
Yes, sir.
If we have about 40,000 of such patients that have been discharged, so does it mean there's a treatment the government has that they are not telling the populace?
Exactly. There's a treatment for it. They are not telling us. If you tell us that over 40,000 people have been discharged from COVID-19, then how did you treat them?
Okay.
Let us know, because you are telling us that we are daft and we are stupid. We don't know We have stupid doctors, we have stupid nurses in Nigeria.
It can be so.
Not on their own treat COVID-19 cases except NCDC. For crying out loud, who are the people treating COVID-19 at isolation camp? Are they not doctors? Are they foreigners? Are they Americans? They are Nigerians. So why not tell us a formula, or is it a ritual, or is it a secret code that you cannot tell us the formula? That's why people will not subject themselves to tests. Because people are afraid. They don't know what you want to do with them. Okay, you test us. You now say you want to take us to quarantine or isolation center. Then you forget us there. What is happening there? We don't know. How are you treating them? We don't know. So that means you are performing a ritual activity, a secret activity. Man is generally afraid of mysticism, and sometimes it's mysterious. So your treatment of COVID-19 is very, very mysterious. Nobody knows what you are doing. And you are telling people, you are discharging people. Why not empower hospitals? Hospitals that people can walk in there and check their status. If they are COVID-19 positive, they are treated there immediately. We have seen that it's not COVID-19 is not even a death penalty. Because now the lockdown has been lifted, people are no more dying. When there was lockdown, people were dying. Now the lockdown has been lifted, people are no more dying, and you are still telling us COVID-19. We have to watch it. Very, very insincere. So I feel that Nigeria is just declaring all those numbers. NCDC is more or less interested in declaring those numbers because of the grants that will be given to them by the external bodies, WHO, the UN, UNICEF, and so on. So it's not about the treatment now. It's all about making money for themselves. So the DG, the Director General should come up plainly, resign your appointment and leave that place. You are just wasting Nigerian time, creating unnecessary panic. We are not saying that COVID-19 is not real. But people are making money from COVID-19. COVID-19 has come to stay, just like malaria, typhoid fever, and other sicknesses come to stay. So how do we manage it? That's what you should be telling us. Exactly. Not that come for tests. Then what do you do with the test? You are not doing anything with the test. Only for you to report to the outside body that outside the NGOs and the international bodies that you have social number of people who are COVID-19. What are you doing with the test? Are you treating them? If you are treating them, let the hospitals know about the treatment. We're not in a ritual state. So the DG should sit up or resign that position. Don't use the celebrities and the governors and the top ministers as your strategy to tell people that COVID-19 is real. The other day, the governor of Delta State was tested positive for COVID-19. In just 1 week, they came back again to say it's now negative. How possible? In 1 week.
And that means there must have been some form of treatment that was used for him.
Exactly.
Okay.
Mr. Dr. Chief Raymond, the of AIT, came out to say this was what I was giving the same drugs for malaria. Chloroquine and so on. So why not come out? If you don't want people to abuse the drugs, train doctors and tell hospitals to take care of the patients. I can walk in. For me, I cannot subject myself to test. I can't do that because I don't know what you want to do. So people, public places, business, they are testing your temperature. What are they testing for? Is it COVID-19 or eye fever or malaria fever?
All right, sir. All right, sir.
So what are they testing for? Because once your fever is high, they say it's COVID-19. How about malaria fever? How about typhoid fever? How about other fevers?
Okay, sir.
I think the NCDC should just at the moment they should just keep quiet and let Nigerians be. Enough is enough. Government should take up that responsibility and we don't want this COVID-19 stuff. Let hospitals be empowered to treat COVID-19. Thank you very much.
Thank you, sir. We will still talk more about this. Quite a number of people really have lots to say. And like our last caller, he said the NCDC Director General should resign and stop causing panic. Because according to him, most of these figures are just being inflated so that they can get more grants from external bodies. If that is true, then that means Nigeria, like most of our callers have said, really need to be sincere in their purpose towards curbing the COVID-19 scourge. And if there is any way they can let Nigerians know the treatment procedure and what it entails, they should do that. And like he said, they can also train some doctors to also help in giving Nigerians the right education about it. So all we are saying is that COVID-19 should not be seen from the political angle, but we should be looking at it from the angle of a safer and healthier society, and how Nigerians can really be confident in the approach that the government is putting in place to contain the scourge. All right, thank you so much to all our callers that called in this morning. We really appreciate your call, the passion, and that simply means that Nigerians really want a healthier society and a safer society, and that is meant for you. Nobody wants to be down with any form of ill health or sickness or whatever. So we are working and we are telling the nation to listen to us. In all that you are doing, be sincere and see to it that all the measures you are putting in place are not just for some, but it cuts across, and everybody has access to some of these kits that are being used for some in some sectors of the economy. So we are working towards a safer and healthier society, and that is what we should see in Nigeria. Thank you so much. So tomorrow we will be on Let's Talk Presidency. So we look forward to having you as our guest, and also calling in to talk with us on how we prefer more solutions to likely candidates that can come up for the 2023 election. Thank you so much for being our guest today, and for calling in, and for watching. And for those that will watch later and comment later, don't forget we are on Facebook, Blossom Nigeria. Then don't forget our website, www.blossomnigeria.com, and our YouTube channel. When you get there, as you make your comments on dialog box, you also see some of our previous episodes, and you can be a subscriber. We look forward to having you with us. Thank you so much, and have a wonderful day.